Hello and welcome to today's Periodontology MClinDent Virtual Open Day. Thank you very much for joining us. My name is Shu and I'm a Periodontology MClinDent student and your chair this afternoon. We hope this session will address the course-specific questions you may have and will help you gain an insight into what it's really like to study on one of our master's programs. I'm delighted to welcome today's speaker, Professor Francesco D'Aiuto, who will provide you with a summary of the Periodontology MClinDent program. And there will also be a Q&A session for the second part of the event. The session's being recorded and will be made available on our website following today's event. Now, to introduce our speaker, we have Professor Francesco D'Aiuto. He's the Professor of Periodontology and the head of the Periodontology unit at UCL since 2017. His research focuses on the association between periodontal diseases and systemic diseases, including cardiovascular disease and diabetes, and also on identifying novel treatments for periodontitis. His clinical focus is on the management of periodontitis using both non-surgical and surgical means, soft and hard tissue regenerative therapies, and advanced management and placement of dental implants. Over to you, Prof.
Thank you very much, Shu, and welcome everyone to the session. I'm delighted to share with you some of our information on the program at UCL, and I hope that I have effectively shared my screen with you to just go over our program and in particular make some initial intro and welcoming who helps me in this journey. You've just heard from Shu. I'm the head of the periodontology unit and I've been at UCL now for more than 20 years, where a master of periodontology initiated, and I'm joined as well by important help, Dr. Natalie Leo, who is our deputy program director and associate professor in the unit. We're also thankful to Jason, Mr. Chan, who is our program administrator, who completes our core team for this program, and wishing you any questions to be answered for the future. Is the best person you can see there with his email to ask any questions. UCL obviously hosts us as a program and has been now for more than 20 years, but I just want to reiterate in general terms what this course is for. Obviously, I am a periodontist. I've been a periodontist for more than 15 years now. And I can tell you that I actually attended this course myself. I joined the periodontology unit back in 2000 at UCL as a general dentist with an interest in periodontology. And that's the type of candidates we are keen to attract for such an important program. So general dentists to have some experience in dental practice. So it is the perfect choice if you have just graduated and had an initial experience in practice, at least a couple of years to give you a feeling of managing patients' expectations, dealing with processes of any dental practice, wherever you might be. But you have a keen interest in increasing your knowledge in periodontology. Now, obviously, periodontology and dental implantology are the main two focus of our program, and our interest in gaining that specialist level knowledge has been the focus of this program, who achieved recognition both nationally and internationally already many years ago. So we have a wide range of recognitions, in particular being the first program in the UK that was accredited with the European Federation of Periodontology. That represents for us a good quality accolade, as every 7-8 years a process of renewal of these accreditations allows us to give an offer to all our candidates up-to-date knowledge, clinical, research, academic, on the topic of periodontology. So the course offer in this case will include a wide range of management, assessment of cases, and techniques within periodontology. We take pride of having a diverse and an experienced panel of lecturers and speakers. These are both core members of the unit, but there are also a variety of international renowned speakers that on a rolling basis we invite. And this is one of the advantages of our program that I took myself on when I started as a director, offering everybody not just a single view of the topic, but being able to share with other colleagues ideas, techniques. And as we are in a specialty that evolves on a regular basis, it's very important to have an international footprint and not just national. One of the other characteristics of this course is that we believe, and we strongly believe, that it's important to, as a team, as a group, our students, trainees, and staff members attend together a number of events where we can share our knowledge, but also directly interact with other colleagues, whether they are speakers, whether they are other trainees, in Europe and outside Europe. Obviously, we are located nicely in Europe and finding easier to go to a variety of meetings, both nationally and internationally within the Europe region, but often for research purposes or academic purposes, we tend to go beyond the European barriers. Again, with the idea of sharing together experiences and knowledge. So private special practice is probably the main goal for any candidates for such a course. So anyone that after graduation feels that they want to become experts in a clinical, like periodontology topic, I think they should choose this program in order to achieve that level of knowledge and experience. But that doesn't negate the possibility for those of you that perhaps have an aspiration for a hospital career, hospital position, or academic career. So a specialty training program like this one will form the basis and be recognized internationally to any positions for academia, for instance, or a service or hospital-based position, which might be connected. If you are in for the long journey and you have a keen interest in academia and perhaps following such a program, you might want to also continue, then clearly developing in a PhD program or something equivalent might be the stepping stone. So this is a perfect program to elevate your interest in periodontology and getting to know where research is going. But it's not uncommon, and we have at the UCL, and in particular the Eastman, a very good track record of also allowing candidates with that passion and interest in periodontology to carry on in a variety of roles. We had a number of alumni that following completion of the program, and I give it my personal example, where now I lead the unit where I studied, go and internationally take chances of finding positions in important roles within the European Federation of Periodontology. One of our alumni has been the executive director, as well as part of the executive board. And within the national societies of international students, we had a number of alumni that then took roles and positions within Spanish, Italian, French societies of periodontology, as well as beyond the European level, especially in the Gulf region. Having said that, also this course will give you the basis to be an almost a ticket presentation if you are about to go into a completely different area like industry or organizations, whether are government organizations, hospital organizations, or like in the UK, for instance, the Royal Colleges. Continuing on my presentations, I can then share with you the admission process. So I said that we're looking for general dentists with at least 2 years of experience post-graduation to have meet the minimum clinical requirement. We do require, you see how set clear criteria for acceptance of your dental degree. So please have a look at the admission website to see what are the minimum criteria. And as a minimum English requirements, you will see that current level UCL accepts in order for us to consider your application. The closing date is pretty soon. It is not less than 2 weeks. So we have the closure of the next academic year, 24-25 starting. So please, on the web link you see here, you can find more details in relation to the admission process, which will, following the a deadline, will be followed by shortlisting and an interview process, which allows to find out more about yourself, your interest, and whether you fit very well for the course. If you have any inquiries, as you can see, in addition to myself, you can always email me, Mr. Harry Galloway, in the admission office will be more than happy to provide that information. And going a little bit more in details, but I'm sure when we come to the questions and answers sessions, you might have specific questions. We are strictly a 3-year full-time program, as we abide to the both UK and European Federation guidelines for completion of a specialist program in periodontology. And our course is defined over 10 mandatory modules, which will account for the 540 credits needed for the college to issue with a master. We have 3 years, therefore, or different modules. In year 1, 4 modules are focused in particular on concept of basic clinical science, research methodology, and scientific basis of periodontology, covering not just the historical, but also the up-to-date evidence in relation to periodontology and dental implants. We also then start quickly in the first years, patient management and development of non-surgical and surgical criteria for periodontology. As we move on to our second year, the 3 modules that forms the core of the teaching are focused on the execution of evidence-based practice and techniques in periodontology. And so the number of cases that you'll be managing will have a variety of conditions to be managed. It's non-surgical and surgical techniques, in particular surgical, focusing on the aspects of regenerative, not just resective therapies, as well as preparation and management of cases that would require dental implants for the replacement of teeth, in order to set the basis for your third year, where 3 remaining modules will complete our course structures. And that's where we will focus on more advanced techniques in periodontal surgery, implantology, and the aspects of interdisciplinary management, which is essential for our specialty, comes into place, where you're able to combine interests in other and knowledge in other specialties in relation to periodontology. Obviously, the course will be assessed also with the completion of a research project, which is part of your third years. And in fact, as you see in this current slide, our teaching spans over a variety of methods. We have lectures in the formal classical way of now a lot more face-to-face, but sometimes even online. Seminars where we are debating and discussing the body of evidence on the topic, as well as a variety of workshops that might focus on clinical techniques, learning different components of the periodontology and dental implants. Our timetable tends to be defined heavily on the possibility of working with patients, and this is thanks to the relationship we have as college with the University College London Hospital, Dental Hospital, which is where we perform most of our clinical teaching and activity, and 70% of most contract you will have throughout the course, with a different distribution according to the year. You will be not less than 50% across the 3 years. There will be an independent amount of work you are required to put in particular in relation to studying. You will have a lot of information, especially in year 1, to try and create the body of knowledge and set the basis for learning the techniques. But then you will soon also work on a clinical or non-clinical research project, which represent the basis for your master thesis, which is a requirement from the university to achieve your master award. The assessment of each of our modules that you've just seen across the 3 years is based on a number of formative assessment on a monthly basis. We take advantage both of forms of essays in relation to write, in summary, the knowledge you acquired so far, or to be assessed on a variety of clinical scenarios with a problem-based approach of discussion of simple cases, medium complexity, or more advanced cases. You will, at the end, obviously, for a variety of modules, be assessed by an oral examination with a viva, and the possibility of debating, discussing unseen cases that have been either submitted or unseen on the day, where you will go through a clinical case and debate and justify your choices for treatment. Your degree will complete at the end with the defense of your research thesis, which will be both in terms of an oral viva and a presentation. We are obviously, as part of the accreditation with the European Federation, will have a final exams where both external examiners coming from the college or external to the college and part of the European Federation will come to assess at the end of the 3 years your progress. We are quite fortunate in the last 5 years. We survived COVID, but we also managed to move from a site now quite dated into a new location. As you can see, this nice snapshot of our academic facilities. This is the Rockefeller building, which is the building just opposite to the main UCL Bloomsbury campus. It's hosting a famous museum of zoology, but at the same time, it's hosting ourselves with our offices and teaching facilities. In particular, we are fortunate to have an extensive number of clinical stations for learning and practicing your techniques in relation to non-surgical and surgical aspects of periodontology, as well as dental implants. And this is one of the snapshots of the laboratory skills that we have on our new facility. And these are the clinical suites, rooms where we could perform teaching episodes, in particular when it comes to moving from the bench to a clinical scenario. I mentioned to you that we perform most of our clinical activity within a dental hospital, and this is a great snapshot of the building just opposite. Probably there is only one building aside to the one that hosts our academic facilities, and this is the Royal National Dental and ENT Hospitals, which was built just before the pandemic, and we moved into, over the last 4 years, that over 7 floors above and below grounds defined represents our state-of-the-art facilities where we see patients. And I can see you some snapshots of our new facility, whereby, as you can see here, corridors for patients entry. It's a very patient-oriented facility. You can see this one is a snapshot of a patient corridor that are overlooking beautiful London skies and views, and they're separating all the clinical rooms, which are present on the other side, and each floor it is very well organized in similar fashion. And the dental facility includes a variety of dental areas where each trainee or clinicians, academic staff, or hospital staff perform clinical activity, as you can see in this equipped room, which will be on the 3rd floor, which is our main floor for periodontology activity. As you know, it's not just important to learn and read a lot about, but UCL, there is a great focus on ourselves in supporting your journey through the course. In fact, throughout your course of 3 years, you will have access to a personal tutor at UCL, which will be part of our periodontology team, but you'll have a year tutor from one of our academic members of staff who will be following your journey over the 3 years and able to support you in case there are any challenges and difficulties, at the same time giving you a chance to improve our own program and give us feedback on how we are delivering our teaching. UCL has got an important mission in trying to make sure that your well-being is supported, and you can see here by QR codes and different web link where you can find information in relation to your mental health support, as well as your financial support in case would be needed. And that's where I guide you to go through if you have any questions in relation to support and well-being. And with that, although it was very quick, I'll just say thank you to everyone for listening to us, and I believe we can open the floor to questions, which tend to be often the main focus of an open day discussion. Back to you, Shu.
Thank you. Amazing. Thank you so much, Prof. That was very informative. I can personally vouch that all of what you've just said is true. We, as Prof was saying, can start our Q&A session now. So please feel free to add your questions to the Q&A box. I'll be keeping my eye on that as well. Perhaps whilst, to give a bit of time for that to happen, it might be a good opportunity for me to maybe share my experience as we wait for some questions. So my name is Shu. I'm one of the I'm in my 3rd and final year here now. And I can say it's been an amazing experience. The program challenges, but it's also incredibly rewarding. I look back to the student who joined about 2.5 years ago at this point, and realize how much I've grown, not only as a clinician, but also as a person. And this is due to the incredible mentorship from all the supervisors and leaders and the tutors that I've met. And they continue to inspire and nurture me every day on clinic, practically. And the depth and breadth covered in this course is immense, as Prof might have alluded to in his presentation. But because of that, I do feel prepared both as a clinician, and should I be interested in academia, I feel that this is, I feel confident that this will provide me with a good foundation, with the rigor and the strong basis of research skills that I've learned as well. I really could go on, but I think it might be time to answer some of these questions. So I think we've got a question from one of the participants to ask if there's any chance the 2-year work experience requirement could be waived.
Thank you for the question. Year on year, we find ourselves debating with our candidates of the inclusion of 2 years. The simple answer, unfortunately, is no, because, and I'm a strong supporter of that minimum. I understand often when you start into practice, you might find yourself that you're tied into a flow that it's difficult to get out of. But in order to have the greatest benefit of such an advanced course, we wish every candidate not just to have completed their degree, so that we assume that every dental degree will give exposure to any trainee to a variety of treatments and perform them on patients as well, etc. But as you will be propelled directly onto the front of patients into a very, very busy hospital within a very busy service, communications, management of the cases, ability to deal with unforeseen circumstances are skills that you can only develop when you start working in practice. So I think we have already lowered from 3 to 2 years that requirement some years ago, because we felt that perhaps 3 years was a little bit too long and be limiting for potential candidates who after probably 3 years might have already made up their minds what they want to do. But the waiving of that 2 years at this stage, and I can give even more justification if you wish, it cannot be waived.
Brilliant, thank you, Prof. I don't think we've got any open questions at the moment. Maybe we can give it a few more minutes.
Do you have questions? Sure.
Do I have questions? Prof, where do you see the direction of the unit heading over the next few years?
Well, periodontology, as I alluded earlier, is not a slow progressing specialty. In the last 10 years, especially from a clinical point of view, I can see that we are going at a very fast pace. And I can only see our academic unit that has renewed 6 years ago a lot. We changed completely our team members, and we have over there kept a core team that I've been leading to, setting a strategy over 10 years. And we're just 5 years on. I can see that our strategy is to not just retain the high quality of teaching, which I think is a characteristics that I liked from the start when I joined back in 2000, and gave an edge compared to many other programs I myself either had at the time decided to attend or shared information with. But academic knowledge and excellence only come if you devote time to research. And I think the next 5 years of our team will be successful only if we devote enough time into researching in areas we've now mastered over the last 20 years, mostly clinically oriented when it comes to periodontology as a general topic, often the links with the medical professions and whether the periodontist should have a greater role within medical care. And I'm quite adamant that 20 years of research, some of which we've been instrumental of, will now start to change clinical practice. Yeah, UK is a good example where this is happening, but that's not enough. Obviously, it might be a bit boring from a clinician point of view. I'm a clinician and I always will be. So developing surgical techniques to minimize complications and improve outcome is essential. We are going into the era of personalized medicine. Personalized dentistry comes after. So personalized means improving outcome with minimum efforts from clinicians. And that's where the new digital technology come to help us and give us help in not taking our role, but facilitating the way we can manage patients. And so I can see that if our strategy is right, and UCL is a research-led organization, defining the teaching that we do still within the aim of improving knowledge on different topics, will hopefully give us successful answers going forward, and giving everybody who wants to share the same view to be part of it, either as a trainee or a member of staff, or as we see going along. But thank you for that question. Yeah, it's more like an existential question. What would you do after this master, Shu? As I can see, our colleagues who have joined do not have additional questions, which means either we answered all their questions, or perhaps they're thinking of a more complicated one. What would you like to do after the course?
I mean, Prof, your answer has been very, very inspirational. So I think I've obviously been toying with the idea of being both a practicing clinician, because I think that's a very important part of my career trajectory, but also I think hopefully staying and being inspired by research going forward would be something that I'd be quite keen to explore. And then obviously the mentors that I've had the opportunity to come across have also been very inspiring in terms of wanting to help the next generation and teach. So I think all in all, it'll be quite a few things that I'd like to do. And thankfully, due to this, the wide variety of this program, both from the weekly case presentation point of view and also our thesis point of view, it's prepared me or given me a taste of what I can really invest my time into after the 3 years. So it's more like a stepping stone, really. So, yeah.
Very good.
Just let me have a look at yeah. So I think we might have been very effective in providing information. I think the QR codes might have also been helpful. I wonder if we should maybe leave it a couple of minutes, or before we wrap up for the session. Perfect. Okay. So I think there might not be any more questions. So I'd like to thank you all for your comments and questions, and thank you very much, Prof, for an excellent session. Have a great evening, everybody.
Thank you so much, Shu.
Take care. Thank you.